Hello and good evening, everyone. I hope I'm audible. So welcome to a new live session on Idento. Today we will be discussing some of the important and high-yielding MCQs from dental histology. Okay. So dental histology is like one of the fundamental subjects and it is comparatively easy. And excuse me. Hello and good evening, everyone. So, as I was saying, dental histology is like one of the fundamental subjects, and it like usually dental anatomy together with dental histology, you can expect a total of like 14 questions for the NEET exams. So, from dental histology alone, you can expect a total of like 7 to 8 questions. So, today we'll be mainly discussing the enamel, dentine, pulp, cementum, and periodontal ligament related questions from the dental histology. So if you have any doubt or if you like are not understanding any topic, then you can put your comment in the comment section below. Okay, we'll definitely try to answer it. And okay, now let's begin, doctors. So first question is, in the structure of dental enamel, when observed using high resolution scanning electron microscopy, how can the morphology of a single enamel rod be best described? Okay. So, whether can you describe it like a cylindrical rod with a circular cross-sectional base, or a prismatic rod with a triangular cross-sectional base, or a prismatic rod with a cross-section shaped as an equilateral hexagon, or a thin plate-like structure with irregular edges? Okay. So the answer is option C, a prismatic rod with a cross-section shaped as an equilateral hexagon. So this enamel, we can do the ground section and we can observe it under light microscope. Okay, so this is like what you will observe it under the light microscope. Okay, the image here. Okay, this is how the enamel will appear under a light microscope. But electron microscope has like a very high magnification. Now, like minute structures like the cell organelles inside the cell and all are like all defined with the help of this electron microscopy alone. So when we view the enamel under the electron microscope, it will appear something like this. Okay, so we'll be able to see the enamel rods and their structure and the hydroxyapatite crystal structure, and all will be able to see with the help of this electron microscope. So this is like the pictorial representation of this enamel rods under the electron microscopy. You can see that it will be shaped like a keyhole. or more like a paddle shaped pattern. Okay, so the enamel rods will be shaped more like a keyhole or the paddle shaped pattern with a round head and a narrow tail. Okay, now the head portion, that is the round head, will always be facing towards the occlusal or the incisal side, and the tail portion, the narrow tail portion, will be facing downwards to the cervical side. Okay, so you usually this enamel rods will have a measurement of like 4 to 5 micrometer in breadth and 9 micrometer in length. Okay, so these all these enamel rods, they will be made up with the help of this hydroxyapatite crystals. So these hydroxyapatite crystals, they will be usually ribbon shaped. Okay, these hydroxyapatite crystals, they form the inorganic portion of the enamel. Okay, and they will be usually ribbon shaped. And if you look at the organic portion of the enamel, this organic portion, what they does is they will envelop this hydroxyapatite crystal and they form the rod sheath. Okay, so in the pictorial representation here, you can see that this is one rod. Okay, an example of one rod they are showing, and covering this rod, you will be able to see the organic portion, and it forms the rod sheath. Now, coming to the next question, the curved lines in the following image represents. Okay, these curved lines here. Okay, we are mainly including image-based questions in this session. Okay, more of like image-based sessions were like discussing today, and a few like confusing one-liner factual-based questions were also discussed. Okay, so the curved lines in the following image represents what? Okay, these curved lines, they represent what? Okay, is it enamel hyperplasia or the mamelons or the enamel tufts or the gnarled enamel? Okay, answer is option D, gnarled enamel. Okay, so first let me tell you about the orientation of the enamel rods. Okay, so the orientation of the enamel rods, usually they will be perpendicular to the dentine surface. Okay, but I will tell you also like how it will be arranged in the occlusal and the incisal third, and then the middle third, and in the cervical third of the permanent teeth also. Okay, so this is the pictorial representation of this arrangement of enamel rods in both the deciduous and the permanent teeth. So in the occlusal and the incisal third, they will be arranged in an oblique direction, whereas in the middle third, they will be arranged in a horizontal direction, and in the cervical third, they will be arranged in like an outward direction. Okay, so what is enamel rods, when they reach the cusp tip and all, like the cusp tip and the incisal third, what happens is that they will be arranged in a wave-like manner. Okay, this wave-like arrangement of the enamel near the cusp tips is called as the gnarled enamel. Okay, so the usually you can see here, this is an example of the gnarled enamel. And what is the main significance of this gnarled enamel? If you ask, if it is mainly considered as a functional adaptation. Okay, because of this wavy nature of these enamel rods, what it does is that it has very high strength when compared to the remaining portion of the enamel. Okay, so this gnarled enamel, they have very high strength, and it is usually seen near the cusp tips only. Okay, so in case of any like occlusal forces or like the biting forces, the cusp should withstand that forces. Okay, for that only we will be seeing more of this gnarled enamel in region of this cusp tips. Okay, and it like that it minimizes the risk of enamel fracture, and it is difficult to cut during the cavity preparation. Okay, that is like a clinical significance of this gnarled enamel, and it is not a hypomineralized structure. Okay, we'll be discussing about the hypomineralized structures of enamel later on. So this is mainly about the gnarled enamel. Now, identify the enamel spindle from the following image. Okay, so you have an image, and like A, B, C, D are given. You should identify the enamel spindle from this following image. Okay, so the enamel spindle is option A. Okay, so this is enamel spindle. This is the dentino-enamel junction. This is the dentinal tubules, and this is the odontoblastic processes extending a little bit into the area of the enamel. Okay, so what is this enamel spindle? Enamel spindle is nothing but it is the extension of the odontoblastic processes from the dentine into enamel. Okay, so there are like lots of odontoblastic processes extending into the enamel, but what we call definitely as a spindle is the one with a pointed or rounded and with thickened end. Okay, the head portion should be like round and it should have a thickened end. Okay, such structures we will call it as enamel spindle. Okay, this is also not a hypocalcified structure. This is like just an extension of the odontoblastic process. Okay, and it will be seen perpendicular to the surface of the dentine and in line with the odontoblastic process. As you can see, it is seen perpendicular to the dentinal surface and it is in line with the odontoblastic processes also. Okay, usually high number of this enamel spindle is seen in the cusp region and in ground section. Okay, this is an example of the ground section image. It is usually seen as appear dark. Okay, because it usually appears dark in color in case of the ground sections. Now, coming to the next question, the transverse wave-like grooves marked as A in the given image is. Okay, so what are these transverse grooves? Okay, is it pericymata or is it enamel lamellae or is it the contour lines of Owen and or is it the lines of Salter? Okay, so except I think the first option, all the others are seen in the ground section. Okay, only seen in the ground section image. Whereas the option A, pericymata, is what we see in a like a tooth, like the macroscopic section of the tooth. Okay, what is we see in the transverse wave like grooves that we see on the surface of the tooth is mainly the pericymata. Okay, so these pericymata, it is also called as imbrication lines of Pickering. Okay, remember the name, imbrication lines of Pickering. Okay, they are wave-like grooves. Okay, seen near the cervical third. Okay, they are wave-like grooves and they are arranged parallel to each other like this. Okay, what this pericymata is mainly they are considering it as an external manifestation of the lines of Retzius. Okay, so the incremental lines of enamel is the striae of Retzius. Okay, so the external manifestation of this striae of Retzius is considered as this pericymata or the imbrication lines of Pickering. Okay, so we can usually by visual inspection itself we can usually identify this pericymata, but if you want to like really identify this pericymata, what you can do is you can take graphite and rub a little bit on the area of the pericymata near the cervical region, and then you will be able to identify it clearly. Okay, so that's about pericymata. Now let's discuss the other options also, like the enamel lamellae. Okay, the enamel lamellae was the next option. Enamel lamellae is nothing but it is a leaf-like structure. Okay, it is a hypocalcified leaf-like structure that extends from the enamel surface towards the dentino-enamel junction. Okay, from the surface to the dentino-enamel junction, a leaf-like structure will be extending. So that structures are called as the enamel lamellae, and it is usually hypocalcified. Hypocalcified means compared to the other surrounding enamel, the calcium content will be less in case of this enamel lamellae. So what happens if the calcium content is less is that it will be like easy for the microorganisms to come and attack this enamel lamellae. Okay, so it is mainly considered as a weak point in enamel. So and it allows the passage of microorganisms into the underlying dentine easily. Okay, so that is about this enamel lamellae. Now the next option is the contour lines of Owen. Okay, so where will you see this contour lines of Owen? So this contour lines of Owen are mainly seen in the dentine. Okay, so in case of any disturbance during dentine formation, like nutritional deficiency or because of any disease or because of some environmental changes, what happens is that there will be like the dentine mineralization and everything will be affected. Okay, so what happens is that there'll be like a slowing down of dentine during that period, and then it will again be back to normal. Okay, so this will result in like a attenuation of the incremental lines. Okay, so attenuation of the incremental lines of dentine will happen. So what happens is that like thickened lines like this will be seen in the dentine. Okay, so these lines, they are called as the contour lines of Owen. Okay, they tell you that something environmental or some hindrance has happened to the dentinogenesis process. So there were like a period of like rest and that period of like activity was there. And the difference between these two periods, okay, they mainly shows this contour lines of oval. Okay. Now next is the incremental lines of Salter. Okay, this incremental lines of Salter is nothing but it is the incremental lines of cementum. So you should be like aware about all the incremental lines and all the lines. Okay, like the enamel incremental lines, the dentine incremental lines, the cemental incremental lines, then the reversal lines, then the contour lines of oven, then all the other structures like pericymata, what is an enamel, lamel, spindle. All these should be you should be thorough with the concept because they can ask the question in any way they want. Okay, so moving on to the next question. The line separating prenatal enamel from the postnatal enamel in the image given below is, okay, so this is postnatal enamel and this is prenatal enamel. Prenatal enamel formed in utero stage itself, whereas postnatal enamel after birth. Okay, so what is this line they are asking? Okay, it is answer is option A, neonatal line. Okay, so let's see what this neonatal line is. Okay, neonatal line is another accentuated line, just like the contour lines of oven, but contour lines of oven are seen in the dentine, whereas this neonatal line is usually present in the enamel. Okay, so what this neonatal line is that it separates the enamel that is formed before and after birth. Okay, so enamel formation usually begins in utero itself. So the enamel that is formed before and after birth will be difference in mineralization will be there. Okay, why this difference in mineralization? Because of this abrupt change in the environment, because sudden change in the environment is happened and the nutrition of the newborn infant is also affected. So then there will be like a change in the enamel that is formed before birth and the after birth. Okay, and the line that separates between this prenatal and the postnatal enamel is this neonatal line. Okay, so this is the ground section image of this neonatal line. And it is usually more prominent in case of deciduous teeth and the first permanent molars. Okay, now the area marked A in the following image. Okay, so what is this area marked A in this image? Okay, so it is it peritubular dentine, or is it mantle dentine, or is it intertubular dentine, or is it predentine? Okay, actually it is predentine. Okay, so let's see what this predentine is. Predentine is nothing but it is a newly laid, yet to be mineralized dentine. Okay, the dentine that is like freshly laid and that has not mineralized yet. Okay, such form of dentine is called as the predentine. Okay, it is the innermost layer of dentine and it is very close to the pulp. Okay, it is very close to the odontoblast layer of the pulp also. Okay, it usually is like very thin, like many, like maximum have a width of like 6 to 10 micrometer. And if you look at the histopathological section with the hematoxylin and eosin section, you can see that this area alone takes up less stain. Okay, why the less staining in this area? Because it is less mineralized. Okay, so there will be less stain in this area. Now this predentine, gradually what it happens is that it will again mineralize and it will be part of the normal dentine soon. Okay, so this predentine, it will get mineralized in future and it will go to the normal dentine. Okay, so that's about predentine. Now let's discuss the other options also, like the peritubular dentine and the intertubular dentine. Okay, this is some commonly like confused words that we see in dentine. What is this peritubular or intratubular dentine and this intertubular dentine and all? So you must be thorough with the concept. That's why I have included this along with the options. So peritubular dentine or intratubular dentine, like the name suggests, peri. Peri means around. Okay, so around the dentinal tubules, this type of dentine is present. Okay, look at the image here. This is the dentinal tubule in the center, and around the dentinal tubule, you can see this dentine deposition, which is called as the peritubular dentine. Okay, it is also called as intratubular dentine. Okay, it is present immediately around the dentinal tubules. Whereas this intertubular dentine means the dentine that is between the dentinal tubules. Okay, this is one dentinal tubule, this is another dentinal tubule. So the dentine that is present between these two dentinal tubules is called as the intertubular dentine. Okay, so the dentine that is present between the two dentinal tubules is called as the intertubular dentine, whereas the dentine that surrounds the dentinal tubule is called as the peritubular dentine. Okay, so this peritubular dentine will be more mineralized, whereas the intertubular dentine will be less mineralized. And this intertubular dentine, they form the major bulk of dentine. Okay. So remember this picture to know the differences between this peritubular and the intertubular dentine. Now, next, we will talk about mantle dentine. There was another option also called as the mantle dentine. So let's see what this mantle dentine is. So dentine, generally, like it can be divided into primary, secondary, and tertiary dentine. Okay. So the dentine that is formed before root completion. Okay. The dentine that is formed before root completion is called as the primary dentine, whereas the dentine that is formed after root completion is called as a secondary dentine. And in case of any caries or like any invading agents, the pulp will provide a protective mechanism. Okay, at that time we can see the formation of the tertiary dentine. Okay, so this primary dentine can be again divided into two types. One is the mantle dentine and the other one is the circumpulpal dentine. Okay, so you can see from the picture here, the mantle dentine is the outermost layer of the dentine. Okay, we have seen that the predentine is something that is very close to the pulp, whereas this mantle dentine is something that is very close to the enamel. Okay. So the mantle dentine is something very close to the enamel. It acts as a cushion for the enamel. Okay. It is the first form dentine and it acts as a cushion for the enamel. It is present just below the dentino-enamel junction and it has some special structures which are called as the Wonkov fibers. Okay. These Wonkov fibers are very important because they are made up of type 3 collagen fibers. Okay. And another specialty of this Wonkov fiber is that they are argyrophilic. Okay. What do you mean by argyrophilic means? These fibers have the capacity to stain with silver readily. Okay, that is these fibers have the capacity to stain with silver readily. Okay, that is why they are called as the argyrophilic fibers. Okay, and it is comparatively less mineralized when compared to the circumpulpal dentine. Okay, so I hope now you are clear about the mantle dentine. Now moving on to the next question. Identify the structure marked as A in the following image. Okay, so you have this A, B, C, D and all here. What is this A? Okay, is it the tract or is it primary dentine or is it secondary dentine or is it tertiary dentine? Okay, you can see that some attrition has happened here and the dentine is like exposed here and you can see like very dark colored structure here. Okay, so that is nothing but it is called as the dead tract. Okay, so what is this dead tract? Dead tract means it is the degenerated or endoblastic processes. Okay, it is the degenerated or endoblastic processes. They will appear as something like dead tracts. Okay, it is considered as an initial step in the formation of sclerotic dentine. Okay, so once this dead tracts are seen, then we can see that there is like formation of the sclerotic dentine also. Now, in this area, there will be decreased sensitivity because there are no endoblastic processes. Okay, so there will be definitely decreased sensitivity only, and most commonly seen in the older teeth. Okay, the one that are like untreated and all these teeth, where the dentine is exposed, you can see more of dead tracts in such teeth. Okay, so what happens is that in case of any caries or in case of attrition or abrasion or erosion or because of the cavity preparation, what happens is that these odontoblast processes, okay, they will get degenerated. Okay, now once these odontoblastic processes in the like the upper portion of the dentine gets degenerated, that will send a signal to the pulp. Okay, so the pulp will get the pulp will get cautious, and what the pulp does is that pulp will seal the dentinal tubules that are like just above the pulpal region with the help of production of this reparative dentine. Okay, so the pulp cells will start producing something called as a reparative dentine, and this reparative dentine acts as a seal for the area just above the pulpal region. Okay, so that whatever is causing this degeneration of the odontoblastic processes, they will not reach here. Okay, that is like a protective mechanism of the pulp. So once the reparative dentine is formed, what happens is that the dentinal tubules above this reparative dentine, what happens to them is these dentinal tubules, they will get filled with fluid or gas. Okay. Now, if you take such teeth, okay, the teeth where the reparative dentine is formed, and we try to do ground section of those teeth, what we can see is that while doing the ground section, all these tubules will get filled with air, and they will appear like black color in the ground section here. Okay, so under the transmitted light, they will appear something like black color in under the ground section. So this is an example of that tract under the transmitted light. Whereas in if you change the light pattern into like reflected light, then it will something appear something like this. Okay, it will appear white color in case of the reflected light. Okay, in case of the transmitted light, it will appear as black in color, whereas in case of the reflected light, it will appear like white in color like this. Okay, so this is all about dead tracks. Now, moving on to the next question, identify the type of dentine from the following image. Okay, so this is a type of like, what type of dentine is this? Okay, is this normal dentine, or is it reparative dentine or osteodentine, or none of the above? Actually, the right answer is option C, osteodentine. Okay, so like I had already mentioned, in case of caries or attrition or abrasion or because of erosion or like cavity preparation, there will be like an offending agent that is like that is like attacking the dentine and the pulp. So based upon the intensity of the offending agent, okay, like if it is of high intensity, what happens is that all these odontoblasts processes they die, and the like I had already mentioned, the reparative dentine formation will take place. Okay, but in case of low intensity like offending agent, what happens is that the remaining cells, okay, they will try and form the something called as the reactionary or regenerated dentine. Okay, so both these dentine, that is the reparative dentine and the reactionary or regenerative dentine, are both like forms of tertiary dentine. Okay, what how it is formed is only different. Okay, like if the odontoblastic cells they die because of this offending agent, then these cells will be replaced by some specialized by some cells called as the undifferentiated cells. Now, these undifferentiated cells will start forming something called as the reparative dentine. Okay, so that is about the reparative dentine. Whereas reactionary or regenerated dentine means the intensity of the offending agent is like comparatively less. So it does not have the capacity to kill the cells. So what happens is that the cells will survive, and it will result in formation of something called as the reactionary or the regenerative dentine. Okay, both these are like the protective mechanisms of the pulp. Okay, the offending agent should not reach the pulp, so it is doing its maximum to provide a shield through the dentine. Okay, through this tertiary dentine formation. Okay, that's what mainly happening here. Okay, so this reparative dentine, while forming, it can be formed in many forms. Okay, these are the many forms of reparative dentine. Okay, so this is how a normal dentine looks like. Okay, the dentinal tubules and the cells will be here, and this is how a normal normal dentine will look like. Okay, but in case of a reparative dentine, what happens is that the tubules will be less in number. As you can see here, the tubules will be less in number, and they are like not organized in fascia also. Okay, so this will you will be seeing in the reparative dentine. Now there are another forms of this reparative dentine which is called as the osteodentine. Osteo means bone. Okay, so osteodentine means bone like. Okay, so why bone like? So in the dentine, you can see some cells embedded in it. Okay, these are some of the cells embedded in the dentine itself. So that will give the appearance of a bone. Okay, so that's why it has the name like osteodentine. Okay, so because of the entrapment of cells in the dentine matrix, it will appear something like a bone. Okay, that's why it's called as osteodentine. And then irregular arrangement of the tubules is also seen, which is called as the irregular type of the reparative dentine, and combination like the osteodentine together with the irregular arrangement can be seen in case of the combination type. Okay, so this is what is called as the osteodentine. Now, moving on to the next question. Which gene is involved in dentine mineralization? Okay, genes are important, like especially in the development of teeth. Okay, so the genes that are helping in the enamel formation, genes that are helping in the dentine formation are really important. Like even if you like uh, does not go deep into the topic, you should at least know the names. Okay, the genes which are helping like autoendogenesis process, the homeobox genes and all that, you should be like at least you should know about the name at least. Okay, so the gene that is involved in dentine mineralization is, it is option C, PHEX. Okay, so let's see what this dentinogenesis means. As you know, the dentine formation, and it usually happens during the bell stage of tooth development. And PHEX gene means it is a phosphate regulating endopeptidase X-linked gene. Okay, so the main function of this gene is it helps in all the hard tissue mineralization. Okay, it helps in dentine mineralization, it helps in bone mineralization, and it also regulates the systemic phosphate homeostasis. Okay, so in case of any defects in the gene, we can expect like diseases like hypophosphatasia and all those diseases can be expected. Okay. Now let's look at the other gene. This MAP1B gene is also involved in the tooth formation process, but it mainly helps in the odontoblast differentiation. Since they had particularly asked like which gene is contributing to dentine mineralization, we choose PHEX. If they had asked vaguely like which are the genes that helps in the tooth formation, then we can also include the MAP1B gene, but it only does the odontoblast differentiation. The next is the MLX gene. Okay, MLX, this amylogenin. Okay, MLX gene, it mainly helps in the formation of amylogenin protein. Okay, this amylogenin protein is like one of the like the most abundant protein that is present in the enamel. Okay, so this enamel abundant protein is mainly this amylogenin. So this amylogenin is secreted with the help of this gene, which is called as the MLX gene. Next is the PAX9. PAX9 is also a gene that helps in the tooth development. It helps in proceeding to the birth stage. Okay, so while the tooth formation is happening, this particular gene allows the proceeding after the birth stage. Okay, to bud, to cap, and to bell, all these things, it will help in moving from one stage to another stage. This gene is mainly playing a role. Okay. Now, moving on to the next question. What is the order of cells in pulp from periphery to center? Okay, so from periphery to center, what is the order of the cells? Okay, so this is like the histological arrangement of the zones of the pulp. Okay, so you know that pulp has 4 zones. So they are asking you to arrange the zones from the periphery to the central, how it is arranged. Okay, answer is option C. First, we'll have the odontoblastic zone, then the cell-free zone, then the cell-rich zone, and at the center, we have the pulp core. Okay, so this is the image showing the histopathological zones of the pulp. Okay, here you have the dentinal tubules, and here you have the odontoblastic zones, where you have so many odontoblasts lined in the palisading manner, and it will be adjacent to the predentine. Okay, so just near this, you will have the predentine, like I have already mentioned. And these processes, okay, these odontoblasts, they have tail-like processes. Now they will extend into the dentinal tubules. Okay, now just below this odontoblastic zone, we have the cell-free zone. Okay, the cell-free zone is also called as wheel zone. Okay, remember the name, wheel zone. Okay, now this wheel zone, you will not see, like the name suggests, you will not see any cells on the nerve fibers and other collagen fibers. Only fibers will be seen in this zone. Okay, then underneath it you have the cell rich zone. Okay, so this, in the cell rich zone only, you will be seeing more cells. Okay, like the fibroblast and the undifferentiated mesenchymal cells, mast cells, macrophages are all seen in this cell rich zone also only. Now, below the cell-rich zone, you have something called as the pulp core or the central zone. Okay, the central zone will be like fully covered with lots of blood vessels and nerves. and it also has the amorphous gel-like brown substance in it. Okay, so these are the histological zones of the pulp: the odontoblastic zone, cell-free zone, cell-rich zone, and the pulp core. Okay, these zones of the pulp are very important. Sometimes, like application-based questions, like can also be asked based on these zones, like um, caries had attacked the tooth, and like from which zone the first response will be given, from which zone of the pulp the first response of the pulp will be given. Okay, so, such clinical or like application based questions can also be asked. Okay, so you must be thorough with the concepts. Okay, now moving on to the next question. Identify the correct match from the following image. Okay, so here it is mainly cementicles are given. Okay, you are aware about denticles. Denticles are like pulp stones that are seen inside the pulp. So here they are telling about the cementicles. Okay, the cementicles are nothing but they are calcified bodies that are present in the periodontal ligament. Okay, so like the pulp stones, these cementicles also have a classification. So they are asking to identify the which cementicle it is. Okay, so the you should answer is option D, all of the above. Okay, so cementicles are nothing but they are the calcified bodies in the periodontal ligament. Now there are like two school of thoughts for the formation of the cementicles. The first school of thought is that it is considered because of a microtrauma. Okay, because of microtrauma, there will be tear in the cementum, and because to compensate the tear, what the cementum does is that it will start depositing more and more of cementum, which will result in the formation of cementicles. Okay, that is one school of thought. Now another school of thought is that because of these cementicles, they are usually associated with the cell rust of molasses. Okay, so the cell rust of molasses are usually more commonly seen in the root region, and around these cell masses, what happens is that dystrophic calcification is happening, and that is the that is resulting in the formation of cementicles is like one suggestion. Okay, so it's not like clear like why the cementicles are formed, but two school of thoughts are given. Okay, and the cementicles are more commonly seen in the apical and the middle third and in the furcation areas also. Okay, so this is like the histological image of the cementicles. As you can see, there will be a central dot, and around it, like a whorl-like structure will be seen. Okay, it's like uh, deposition of the calcification, like in a whorl-like manner, is usually seen. Okay. So these cementicles can be classified into three types. One is the free cementicle. The second one is the attached or sessile cementicle, and the third one is the embedded or the interstitial cementicle. Okay, free cementicle means this is the cementum, this is the periodontal ligament, and this is the alveolar bone here. Okay, so free cementicle means it is lying freely in the connective tissue of the periodontal ligament. Okay, such cementicles are called as the free cementicles. Now, this attached or sessile cementicle means like one or two or three cementicles, they what they will do is that they will join together or they will fuse together to form a calcified mass, and this calcified mass will get attached to the cementum. Okay, so such type of cementicles are called as the attached cementicles. And then you will have the embedded cementicles. Embedded cementicles means they will be like attached to the cementum itself. Okay, so these are the three types of cementicles: free, attached, and embedded. Okay. Now moving on to the next question. The ability of the cementum to repair itself to re-establish the root outline is known as. Okay, this is like a recently asked question for the NEET exam. So the ability of the cementum to repair itself to re-establish the root outline. Okay, it is known as what? Okay, it is known as option C, anatomical repair. Okay, so in case of any trauma to the cementum, as I had already mentioned, cemental tears and all those can happen. So in case of any trauma to the cementum, what it does is it has the capacity to regenerate itself. Okay, so there are two ways by which this cementum repairs itself. So one is called as the anatomical repair, and the other one is called as the functional repair. Okay, so in anatomical repair, what the cementum does is that, like if there is a defect, a new cementum will be formed and the defect is completely closed. Okay, that is called as the anatomical repair. Okay, so in anatomical repair, what it does is the new cementum will form and it completely fills the defect. Okay, so in case of anatomical repair, there will be continuity of root surface, and the periodontal ligament attachment also is like not disturbed. It is like continuous on. Okay, now there is another type of repair which is called as the functional repair. Okay, in functional repair, what it does is like new cementum is like not formed, but what it does is that the underlying bone is there, right? The underlying bone will grow and close this defect. Okay, the underlying bone will grow and close this defect in the cementum. Okay, like this. The picture is shown here. Okay, like this, the underlying bone will bulge towards that defected area, and it will try to maintain the distance of the periodontal ligament, and it will try to close the defect. Okay, so this is called as the functional repair. Okay, only a partial, only at the end, only a partial part is like filled by the cementum, but and it will create something like this. Okay, a bay-like defect like this is formed. Okay, this is an example of a bay-like defect, and the pedial width is maintained by the bony projection like this. Okay, so that's all about the cemental repair. So I hope I had made myself clear. So if you're having any doubts, you can comment under this video. We will definitely try to answer it. So all the best for your preparations. Do well. Good night.